So one of the things that I really like to do when we've got an area that just needs an extra bit of help, it's using the technique called slide and glide, where we're actually just going to connect really gently with the skin. We're not going to brush over the skin, we're not going to deeply massage into that skin, but we're just going to make a connection with the skin. One hand is going one side of the scar area and the other hand is going to the other side. Now this is to actually get into deeper, so it's really good for breast surgery and also for lower abdominal surgery, where we need to open up through the abdominals and the hips and the legs. So a really lovely way of working with the scar when it's in its later stages of healing. So not something I would do in early healing phases, but definitely something to open up the fascia in later stages of healing. So what we're going to do is we're going to use one hand as an anchor and we're going to use the other hand as a stretching modality. So this one hand, and it doesn't matter which one anchors, one hand is going to anchor and the other hand is actually going to stretch away, and you get a lovely stretch in between the two hands. Now you can do this quite close together, or you can do it in a really wider expanse of skin. So when you're doing that, it's really lovely just to feel where that stretch and that tension is being held, and just very gently, and it doesn't need to be a lot of movement, but really gently just feel that tension ebb away, and then just give it a little bit of a rock and allow that area just to relax, and just come in and just feel how much looser the skin feels in that area, and just making sure that you're working with the person that you're working on, or if you're doing this yourself, that you're really listening to those cues to actually hear what the body is saying. So if it's saying it's too much, we back off. If it's saying, oh, that's quite nice and lovely, we just expand it a little bit more just to see how the body reacts to it. Again, with all of our techniques, this is about trying it, actually listening to the body, listening to the connection that we have, and allowing ourselves to really allow the body to tell us exactly what it likes and what it doesn't like. If you want to intensify that, you can actually do an opposing stretch. So you'd actually be taking the skin in opposite directions, and that can be on a diagonal, that can be on a straight line, or even getting it to rock back and forth in the same direction, so having both hands going in the same direction. So give it a try. You can do it on yourself, as I say, or you can do it, you can actually ask somebody else to do it, but if you are getting somebody else to do it, just teach them the slide and glide first and allow them to actually get used to that first on somewhere like a forearm, so that it's not too intense for you. And remember that communication. Even if you're doing it yourself, just remember that communication and really get that going.